Hello, guys. Today I am explaining amyloidosis. So, what is amyloidosis? What is the pathophysiology of it? So, when there is normal protein produced in enormous amount and small fraction of that enormous amount folds incorrectly, or there is abnormal protein which is produced in normal amounts but it folds incorrectly. Both of the misfolded proteins build up and form the beta sheets of that proteins and deposited into tissues and organs, causing the damage. And these proteins are mainly amyloid proteins. So, this is the main, very simple pathophysiology of it. Now, let's go to the types of amyloidosis. So there are mainly five types: AL amyloidosis, AA amyloidosis, familial amyloid cardiopathy, systemic amyloidosis, and localized amyloidosis. Let's start with AL amyloidosis. So, what happened? The disorders like plasma cell disorder, like multiple myeloma, in that there will be some plasma cells producing more light chains than heavy chains of immunoglobulins. So what happened that these light chains leaked out into blood and some of them get misfolded into a L chain, which is a amyloid L light chain. So this will form an AL protein. So this misfolded AL proteins now build up into tissues and organ, causing the damage. This is the basic thing, and this is known as AL amyloidosis. Now let's go to the next one, which is AA amyloidosis. In AA amyloidosis, the protein named serum amyloid A is secreted by liver during acute inflammation. This is really normal. Like serum amyloid A is secreted by liver normally during the acute inflammation. But when this inflammation being for longer time in disease like IBD or RA, rheumatoid arthritis, or any kind of cancer, what happened that this serum amyloid A will secreted in larger amounts and leaked into blood. Same happen with this amyloid also. They get misfolded. Now these misfolded amyloids will form AA proteins and build up in tissues and organs which cause the damage. Let's go to the next one, which is familial amyloid cardiomyopathy. What happened here that it is a genetic amyloidosis where there is a mutant protein named transcythin transcythin, also known as TTR, which get misfolded and leaked into blood. Now this specifically this misfolded protein TTR goes into the heart tissue and get accumulate into the heart walls, resulting into restrictive cardiomyopathy and also known as familial amyloid cardiomyopathy. Let's go to the next topic, which is systemic amyloidosis, where these amyloid proteins, can deposit into various organs. So, first one is kidney. What happens in kidney? These amyloid proteins will go to podocytes and damage it. Because they damage the podocytes, albumin leaks out from the body in the urine, causing albuminuria, and there will be low albumin. So, hypoalbuminemia in the body, which decreases the oncotic pressure, causing edema, and increases the lipid synthesis, causing hyperlipidemia. These are the symptoms of nephrotic syndrome. Now, it can also accumulate in heart. So it can accumulate in two places in heart. So it can deposit into heart wall, and it can interfere into electric conductivity of the heart. So, if it will deposit into heart wall, it can cause destructive cardiomyopathy, but it can interfere with electric conductivity and cause arrhythmia, means irregular heartbeats. Okay, it can also deposit into intestines. So how it can deposit? So it will damages the intestinal villi, which will lead to malabsorption. It can also deposit into liver, spleen, and tongue, results into hepatomegaly, splenomegaly, or enlarged tongue. It can also deposit into nerves, causing pain, numbness, diarrhea, and other symptoms. Okay, let's go here, and we see the cells which are responsible for protein synthesis can be hepatocytes or B cell clone. Now, these clones are doing their work, and when they start making beta sheets, and they will start accumulating in different parts, like accumulation in glomeruli, interstitium, atrial wall, basement membrane, and causes different kind of damages. You can see here how it can causes different type of damages. Okay, let's go to heart. So what it can do in heart? You can see the normal heart and amyloidosis heart. You can see the deposition of amyloids in the myocardium. You can see the deposition of amyloid proteins in tongue, in eyes, in periorbital area, in nails, jugular vein distension and alopecia, submandibular swelling, and shoulder pad. Let's go to the next topic. Okay, now there is localized amyloidosis. In localized amyloidosis, there are the two main diseases. You can say the first is Alzheimer and second is diabetes mellitus type 2. So, what happened in Alzheimer's? As we know, Alzheimer is neurodegenerative disease. What happened that here there is a beta peptide which club up and forms plaques. These plaques will interfere in neuron signaling and or get deposited into blood vessels, which is also known as amyloid angiography. These deposition weakens the wall of the blood vessel, make them weak, and increase the risk of that rupture and hemorrhage. These all can lead to the inflammation in the brain, which can damages the brain cells, ultimately leads to the brain function decrement, which can also cause memory loss, or we cannot learn new skills, etc. and etc. What happened in diabetes mellitus type 2? Here, the pancreatic cells, the beta cells, which secreted high amount of insulin in this diabetes. So, what happened with this insulin production? They also secrete amylin protein. Over time, this amylin protein start aggregating in beta cells only, causing the inflammation and ultimately the death of that beta cells. So, this is localized amyloidosis, which can happen in brain, CNS, in causing Alzheimer disease, and in pancreas, causing diabetes mellitus type 2. Okay, let's go to the next topic. What are the symptoms? There are n number of symptoms regarding amyloidosis. Where it can deposit, it can cause symptoms. So it can deposit anywhere in the body. You can say skin, heart, liver, spleen, tongue, CNS, nerves, uh, intestines, heart, anywhere. And it can cause different kinds of symptoms. So what happen if it is deposit into kidney? We can see proteinuria, azotemia. We know that we can see nephrotic syndromes like hypoalbuminemia and edema. Then there will be hepatic involvement. If it is in liver, there will be hepatomegaly. If it involves lungs, there can be dyspnea, hoarseness, wheezing, and airway obstruction. If it is in heart, myocardium, restrictive cardiomyopathy, and it can also lead to heart failure. If it is in fingers and toes, it can cause peripheral neuropathy. If in cerebrum, it can cause cerebral hemorrhage. Gastrointestinal amyloidosis can cause abnormalities of esophagus, intestines, causing malabsorption, bleeding, internal bleeding, pseudo obstruction, etc. It can also cause some kind of symptoms through soft tissue, which can include carpal tunnel syndrome mainly. There can be involvement of thyroid gland, which can resemble the Hashimoto thyroiditis. If there is lung involvement specifically, there will be pulmonary nodule and cyst. There can be pleural effusion and alveolar deposits. If there will be eyes, you can say involvement of eyes, there will be periorbital swelling, or you can say uh, etc etc. You can say raccoon eyes, bruising eyes, bruising like mm, coloration, discoloration of the skin, etc. Okay, here you can see what main uh, symptoms you can find, like glaucoma, dry eyes, seizures, stroke, arrhythmias, cardiomyopathy, orthostatic hypotension, cardiac failure, diarrhea, vomiting, and nausea, constipation, carpal tunnel syndrome, renal failure and nephrotic syndrome, muscle weakness, neuropathic pain, urinary disturbance, erectile dysfunction, and sweating abnormalities. Let's go to diagnosis and treatment. So, mainly diagnosis is by biopsy. The type of amyloidosis is determined by variety of immunologic, genetic, and biochemical tests. Mass spectrometry is the most sensitive and specific method for amyloid typing. Okay, what happens with treatment? Appropriate supportive care we will do, because there will not be any treatment for uh, decreasing those deposits or removing those deposits. So like the end result will be organ transplantation for improving the quality of life, or we can treat the underlying process. So for AL amyloidosis due to plasma cell or lymphoproliferative diseases, we can give chemotherapy. For secondary AA or anti-infectious or anti-inflammatory drugs. For hereditary amyloidosis, we can give small molecular stabilizer therapeutics and gene silencing drugs, which will inhibit those cells which are producing, or which will inhibit the gene of that system. Okay, so here you can see the biopsy. You can see here the case of localized amyloidosis, where it is light chain amyloidosis in small intestine. Here you can see the staining, and this is the main thing. These are the specific and non specific diagnosis process. This is the case where we can see the ECG of them. Can you see the ECG? There will be diffuse QRS. Can you see? It is really blur, but there will be diffuse QRS. And in CT scan, you can see the diffuse, like endocardial walls, which is diffused. See? Okay, that's all. Thank you.